Okay. I don't know if we have to go back and repeat my entire introduction. Is the applicant, are you attorney for the applicant? Are you okay without me repeating the entire introduction?
Absolutely.
Thank you. All right. As you have just been notified, and I have too by our host Zoom, this hearing is being recorded. I wish to point out that by appearing on camera in this virtual hearing, you are consenting to being filmed. If you wish to revoke your consent, please do so at this time. The CON portal contains the pre-hearing table and record in this case. At the time of its filing Monday, the exhibits were identified in the table from A to U. The applicant is hereby noticed that I am taking administrative notice of the following documents: statewide health facilities and services plan, the facilities and services inventory, the OHS acute care hospital discharge database, and the all payer claims database claims data. I also wish to take notice of two pending CON applications from the same applicant. The first being 20-32411-CON, HHC Surgery Center Holdings LLC and Southwest Connecticut Surgery Center LLC. And the second hearing being 21-32423-CON, Hartford Healthcare Corporation, DBA HHC Surgery Center Holdings and Surgery Center of Fairfield County LLC, and SCA, the Connecticut Partners LLC. I know that the hearing officer in that hearing also took administrative notice of our hearing as well in his order. I will also be taking administrative notice of the hospital systems HRS data, our financial and utilization data, and also prior OHS decisions, agreed settlements, and determinations that may be relevant to this matter. Counsel for the applicants, can you please identify yourselves for the record?
Surely. My name is Joan Feldman, and I am an attorney with Shipman and Goodwin. Thank you.
Thank you very much. All right. In addition to those exhibits listed in the table of record, a public comment file may be added, which will be updated from time to time. Attorney Feldman, do you have any additional exhibits you wish to enter at this time?
No, I do not, but I would like to reserve the right to comment on some of the utilization data, including but not limited to the APCD, all claims payer database information that you'll be reviewing.
Okay. All right. It will be entered and used as needed, if needed by me.
Okay.
All right. So we will proceed in the order established by the agenda for today's hearing. I'd like to advise the applicants that we may ask questions related to your application that you feel have already been addressed. We will do this for the purpose of ensuring that the public has knowledge of your proposal and for the purpose of clarification. I want to reassure you that we have reviewed your application, the completeness responses, the pre-filed testimony, and I will do so many times before issuing a decision. As this hearing is being held virtually, we ask that all participants, to the extent possible, should enable use of video cameras when testifying or commenting during proceedings. All participants should mute their devices and should disable their cameras when we go off record or take a break. Please be advised that we will try to shut off the hearing recording during breaks, but it may continue. If the recording is on, any audio or video not disabled will be accessible to all participants in the hearing. Public comment taken during the hearing will likely go in order established by OHS during the registration process. However, I may allow public officials to testify out of order. I or OHS staff will call each individual by name when it is his or her turn to speak. Registration for public comment will take place at 2 p.m. and is scheduled to start at 3 p.m. If the technical portion of this hearing is not completed by 3 p.m., public comment may be postponed until the technical portion is complete. The applicant's witnesses must be available after public comment, as OHS may have follow-up questions based on public comment. Are there any housekeeping matters or procedural issues we would like to address before we start, Ms. Feldman? Or Attorney Feldman? Sorry.
Yes, one, in all due respect, I think it would be incorrect to refer interchangeably to Hartford Healthcare Surgical Holdings as Hartford Hospital. It is not. Hartford Healthcare, as you may know, is has more than one hospital in the state of Connecticut. So
Is it okay if I refer to you as HHC then?
perfect.
All right, we will refer to you as HHC.
Thank you.
All right. Is there an opening statement from the applicant?
Yes, there is.
Go ahead.
First of all, good morning, Hearing Officer Novi. It's so nice to meet you. And it's lovely to see, again, OHS staff. And we appreciate your efforts and time this morning. Today, we're before you with an application that was first submitted to OHS approximately 2 years ago. Specifically, it's a proposal for Litchfield Hills ASC to transfer 51% of its equity interest to HHC Surgical Holdings. Given the amount of time that has passed, we realize that some of the data will need updating by way of late files. However, none of the underlying rationale and assumptions relating to this application have changed. As you know, this is an application for approval for HHC Surgical Holdings to become the equity owner in Litchfield ASC. This is not an application for a new ASC, whether or not there's a need for an ASC, because that has previously been established. The applicants understand what OHS must consider in its review of this application. Enhance patient access, lower cost, and improved quality and outcomes. Therefore, my opening comments, Dr. Spiro's and Ms. Sassy's testimony will focus on addressing these key points. First, I just want to provide some essential background. I can't state this enough, but commercial and governmental payers are requiring hospitals to provide lower cost alternatives to hospital-based care. How are they doing this? How are they requiring this? They are doing this through their plan design. Specifically, if you were to look at any local coverage determination guidelines or policies on the websites of payers, the plans no longer cover hospital-based surgeries if the same procedure can be safely performed in a lower cost ASC. I will say that's with exception with respect to Medicaid, and I'll discuss that later if you like. This means that many health plans are no longer covering many surgeries that historically had been provided in inpatient settings only. Hartford Healthcare as a system, healthcare system, has been committed to providing lower cost alternatives to hospital-based medical care prior to these coverage evolution by plans. Specifically, HHC through HHC Surgical Holdings has been endeavoring, as you may know, to provide its patients access to a high-quality ambulatory care network. As you also know, the Litchfield ASC has served the Torrington and surrounding communities for 17 years. HHC shares a similar commitment to this very same community through its ownership of Charlotte Hungerford Hospital. You will hear this morning from Dr. Spiro all of the reasons why Litchfield Hills ASC desires to partner with HHC. Based upon the 3 rounds of completeness questions, the focus is evidently on cost and access. But I must say that any cost increases that may be projected are a byproduct of comparing an ASC with less complex procedures with an ASC with very complex procedures. While the applicants have not shared rate data as prohibited by law and contractual obligations, the cost of providing a modern, technologically advanced, and fully integrated ASC will still be significantly lower than the cost of providing hospital-based services. Should the proposal be approved, the ASC is expected to recruit 3 new orthopedic surgeons who will transfer their cases from Charlotte-Hungerford Hospital to the ASC. One of those surgeons is a spine surgeon, one is a hand surgeon, and one is a sports medicine surgeon. All surgeons will comply with Hartford Healthcare's financial assistance policy, also known as its charity care policy. This partnership is in pursuit of the triple aim: improving the patient experience, improving the health of the population served, and reducing the cost of care. There are so many benefits to discuss, so I will now turn to Dr. Spiro. Thank you.
Thank you. Just want to clear up. I am taking notes down to the right. So if you see me looking off to the right, I'm just taking notes. I am still paying attention.
Thank you.
All right. At this point, I would like to ask the Attorney Feldman, if you could please identify all individuals by name and title who are going to testify on behalf of the application. And they should each, are they in the room with you, or would they need to turn their cameras?
There are 2 individuals who will be providing testimony today. Dr. Lane Spiro from Litchfield Hills Ambulatory Surgery Center, and Ms. Donna Sassy, Vice President of Integration for Hartford Healthcare.
All right. Are these the individuals sitting to your left and your right?
Dr. Spiro's to my right here, because
Okay.
I don't want to mess up left and right.
I understand.
And Donna Sassy is right here.
Perfectly. So I don't need to ask them to turn on their cameras. All right. Thank you very much. If I could have you both raise your right hands, I will swear you in right now. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the testimony you are about to provide and the pre-filed testimony that you have provided will be the truth, the whole truth, and nothing but the truth, so help you God or upon penalty of perjury?
I do.
All right. Thank you. Go ahead and put your hands down. All right. When giving your testimony, please make sure you state your full name and adopt any written testimony that you have submitted on record prior to testifying today. The applicants may now proceed with their testimony, and I ask that and that you define any acronyms that you use for the benefit of the public and clarity of the record. Okay. All right. You may proceed.
Good morning, Attorney Novi and the rest of the OHS staff. I would like to adopt my pre-filed testimony.
Thank you.
Okay. Thank you for the opportunity to present this CON application for Hartford Healthcare and my surgery center, Litchfield Hills Ambulatory Surgery Center. And we're in the Torrington area, and we are the only surgery center in Torrington. As Attorney Feldman stated, there's also Charlotte-Hungerford Hospital. And my focus today will be on the change of ownership from Hartford and Litchfield Hills Surgery Center. Right now, we provide care, very high quality care in the surgery center, but as healthcare progresses, there's more and more systems that need to be included in order to be able to provide that high care. Hartford Healthcare has a lot of experience in this area, and that is why we've chosen to partner with them. Presently, we take both commercial and governmental payers, and we will continue to do that, even with this partnership. The idea is to decrease the overall cost of the care from the hospital to the ambulatory surgery center, and at the same time provide a high quality of care. We've had a lot of success over the last 17 years, along with multiple partners that are in the surgery center and other physicians, and we want to continue that success. And we understand that there are more procedures that need to be followed in order to continue that success. As with healthcare, procedures have progressed, equipment has progressed, and we're physicians. We need help in order to be able to continue that high quality of care for all of our patients and expand that care to the rest of Torrington. As Attorney Feldman stated, there are other physicians in the community that would also like to bring their patients to an ambulatory setting. There are protocols for infectious control and other regulatory protocols that we are not experts in, but Hartford Healthcare have expertise in and would be very assistant in maintaining those protocols.
All right, Dr. Sparrow, I apologize. I'm going to interrupt you for a second. If you could please state your name and then spell your last name, that has not been stated for the record.
I apologize. Lane Spiro, my last name is S-P-E-R-O.
Continue with your testimony. I do apologize.
Okay. There are many other choices in the environment in which to partner with, but because of the expertise that Hartford Healthcare brings to the table, that is why we've chosen to partner with Hartford Healthcare. Presently, we provide orthopedic and related orthopedic procedures, pain management procedures, and we will continue to provide that care in the ambulatory surgery center with Hartford Healthcare. There's also other procedures within Hartford Healthcare that we wouldn't have access to because they're a larger healthcare system that from their hospital system, from their other ambulatory surgery systems, that we would have access to by partnering with Hartford Healthcare, like their medical record, Epic, which really helps in the overall healthcare of the patient to be comprehensive in tests, in reports, procedures, and such, that they have access to right on their phone. We presently participate in both Medicare and Medicaid services and will continue to participate in those services even after the merger. I just want to stress that the point of this merger is to increase the quality of care, increase it to more people within the community, and bring them another choice, potentially, or a cheaper or more cost-effective choice within the Torrington area. Thank you very much for accepting my testimony.
Okay, thank you very much. All right, Ms.
My name is Donna Sassy, S-A-S-S-I.
Okay.
Good morning, Attorney Novi and members of the OHS staff. Again, my name is Donna Sassy. My role is Vice President of Partnership Integration for Hartford Healthcare Corporation. At this time, I'd like to adopt my pre-filed testimony, please.
Thank you.
Thank you for the opportunity to speak this morning in support of the Certificate of Need application for HHC Surgery Center Holdings to acquire 51% membership interest in Litchfield Hills Ambulatory Surgery Center. My focus today is going to be on the value contributions that HHC Surgery Center Holdings will make and deliver to Litchfield Hills Surgical Center and its community that they serve. I also want to share that this proposal is very critical to Hartford Healthcare's mission of providing the highest quality, equitable, and most cost-effective care to the patients and the communities that we serve. With the goal of highest quality and most cost-effective care for our patients, Hartford Healthcare over the last 5 years has been very proactive in disrupting our historically hospital-based services and driving care to lower cost settings. So what that means is everyone who had ambulatory services from radiology to urgent care to endoscopy services and ambulatory surgeries, they would have to go to an acute care hospital. And so what we have done is created a network of care within the communities that the patients live and work in. And we have been successful in doing so in creating all these joint ventures in ambulatory services, as I listed, because of our partnerships with the community providers or experts in radiology. So we have been successful, and that's evidenced by our patient experience scores being in the top decile, as well as we were recognized this year in 2020 by Leapfrog for having 2 of our centers be in the top 12 in the nation for quality and safety. And, you know, during these last few years, as we built this network of ambulatory care, what we realize today is nearly 40% of all the surgeries being done in Hartford Healthcare are now being done in a footprint that's outside of the hospitals. When we look at the cost of lowering the cost of care, what we're talking about is that we are lowering costs for surgery and endoscopies between 25 and 40%.
Hold on, I'm
we
just
are
gonna pause you because I would like to just make sure I've got that. You said 25 and what?
25 to 40% lower cost in the ambulatory setting as opposed to the acute care hospital-based outpatient departments.
Thank you.
And, you know, the payers and the patients, because of the lower cost, benefit from this. But overall, our healthcare system and the communities at large benefit from it too. And the reason being is that the hospitals are congested and we are decanting cases and increasing capacity for the acute care hospitals to take care of the more acute patients. Excuse me. So, you know, as I've mentioned, we've had very good success, but what I'm most proud of is that we are able to build superior care, high quality clinical care by partnering with our ambulatory surgery centers. We're doing this by standardizing care. So any patient that goes into any Hartford Healthcare facility is going to get the same level of care. We're doing this by standardizing policies and procedures, whether they be infection control or they be charitable care policies or you know, medical office standardization of, you know, credentialing and how we manage new procedures. In other words, the experts at the acute care hospital have already credentialed and know the criteria for physicians to have in order to be credentialed for new procedures in the ambulatory setting. So we use that historical and evidence-based knowledge to create the same environment in our ambulatory surgery centers. Through this partnership, we have offered an exceptional and modern clinically advanced surgery centers. And we've done that because we have the capital to be able to invest in the new technology that is required to do these more acute cases. Again, like Dr. Spiro mentioned, care coordination is better because we have a commitment from our partners to go live with Epic in our centers. They might not have been able to go live with Epic if it had not been for this partnership, because we are able to financially support that endeavor. Through Hartford Healthcare's partnership, these centers are run efficiently and provide patients high quality, lower cost care. As we look forward in the future, we know that the payers and government are going to increase the number of cases that move from the acute care setting to the ambulatory centers. And without this partnership with LHO, they might not have been able to be as prepared as we will make them to receive and manage these patients at a high level of quality and safety. I've mentioned a couple of things that we bring to the table as far as benefits to our partners. I just would like to go over a few other things that we do provide for our partners. We have evidence-based performance benchmarks and data that we track and trend the performance of our centers. We work with them for improvement processes. We provide them access to education and simulation, which the importance of that is so great when we have new technology. We prepare the teams in a safe setting. Physicians can go up and test new technology. So that is a good benefit that we bring, as well as our group purchasing organization. We are able, because of our scale, to be able to shift our supplies to help support our ambulatory surgery centers. Every day we're faced with national shortages and backorders. And for example, the most recent thing that we were able to help our ambulatory surgery centers with is there's a testing machine that all autoclaves have to be tested for biologics. And their machine to process the test tube was broken. They had put an order in for a new machine. It was going to be at least 3 months. So Hartford Healthcare was able to provide them with a loaner, so it didn't disrupt the schedule for the patients. We could continue to provide patients in the community what they needed, and we were able to have operations as normal. So it was a true testament to how our partnerships can enhance and support our ambulatory surgery centers. Going live with Epic, as Dr. Spiro mentioned, helps the physicians and the providers at their fingertips and at the site of care. They'll have access to critical information about a patient, allergies, medications. Have you ever gone to the doctor and forgot to give them a med that you're on? This is the quality and safety that it assures for our patients. So we are on that Epic journey and implementation for our centers, and will be with our partnership with LHO. We have, we talked a little bit about preparing patients for surgery. We are able to have dedicated experts in our pre-admission centers, be able to sit with the patients, be able to get them ready from education to testing, and also have anesthesia, be able to put a plan together that's appropriate for that patient. We talked about capital, being able to enhance what we need at our centers because of our capital contributions. And although this is representative of a small number of things that we benefit, We provide benefits for the ambulatory surgery centers. You know, in the end, it is the most cost-effective, highest quality care that we can provide. So we talked about that our centers will all participate in our financial assistance policy. And we also shared today and are committed to, you know, continuing to care for the under and uninsured patients, the Medicare and Medicaid population specifically, as well as we will make sure it's equitable care. We will do that through our standardization of the policy per class, culturally and linguistically appropriate services. We will make sure everybody is treated and understands what kind of care they're getting, no matter what language or culture they come from. So in summary, both our commercial and governmental payers are leading the national initiative for our hospitals to move care from a hospital to an ambulatory setting. Hartford Healthcare is, you know, committed to establishing a network of ambulatory sites that offer lower cost alternatives to hospital-based care consistent with the high level of care patients receive from the acute care hospitals within Hartford Healthcare. When the transfer of care, you know, we are creating an environment that really patients have access, that it's equitable, in the end it's cost effective, and we will provide that for the Litchfield Hill Ambulatory Surgery Center patients if this partnership is approved. I want to thank you for this time to testify, and I'm available for any questions as you need.
All right. Attorney Feldman, do you have any follow-up you'd like from either of your witnesses?
Well, based on Ms. Sassy's testimony, it sounds to me like the FAA needs to partner with HHC also.
I think they may want to look into that. All right. So at this point, we would now go to questions from our department. But I would like to see, Mr. Lazarus, would you like to take a quick break before we head into our round of questioning?
Yes, we can take a 5-minute break. That would be great.
Okay, let's give 10 minutes. Are we okay with meeting back here at 10:20? Is that okay with you, Attorney Feldman?
That's great. Thank you.
We will now break for 10 minutes, and I will see everybody back here at 10:20. Thank you. All right, as you were just informed by the beautiful Zoom voice, we are now recording again. It is 10:20 a.m. and we are back from our break. And at this time, we will continue with the evidence portion, and OHS will begin with their questions. And I see that both witnesses for the applicant are present.
Hello, again, I'm Jessica Rival from the Office of Health Strategy. I have a few questions for you today. I will leave it up to you as to who is the best person to answer each question. First, given the long history of operating at the current location in Torrington, why is now the appropriate time for Hartford Healthcare Surgery Center Holdings to acquire 51% of the Litchfield Hills Surgery Center?
That's a very good question. We've had a lot of success with our surgery center, but as healthcare has become more complex with the regulatory environment, with the technology, we are expert physicians, but we're not administrators. And so we take care of patients, and we need help with the other sorts of things that go on with running a healthcare facility. And Hartford Healthcare has that expertise already in the making. They already do it for their hospitals, and that would just extend to our surgical center.
So there was no particular event that triggered the timing proposal?
Well, I think during COVID, that was an event that sort of made us sit back and say, look, we need help in order to manage the healthcare in general. And in fact, had we been part of Hartford Healthcare, we would have been able to offer assistance for patients needing ventilators, needing the treatments during COVID, but because we were an independent center, we weren't able to perform those services.
And what are the applicant's long-term strategic plans for the provision of healthcare services in the proposed service area, including any plans to reduce, eliminate, or expand services?
We have no plans to reduce or to eliminate services. You know, our strategic plan is based on lowering the cost of care and providing access, again, in the communities at which the patients live, away from the acute care hospital.
What about expanding services? Are there any current plans?
All right, can you, this is Attorney Feldman, can you, Ms. Rival, just specify what you mean? Do you mean by increasing the number of ORs or the specific services performed at the surgery center?
The specific surgeries at the surgery center.
I think earlier I may have misspoke when I said that the third surgeon is, I think I said a spine surgeon, hand surgeon, and sports medicine. Actually, it's not a hand surgeon that's coming, but a foot and ankle orthopedic surgeon. So that will be a new procedure that will be offered.
Okay.
I have a follow-up, actually. Ms. Sassi, you mentioned that you are looking to move more services out of the acute care setting and into the ambulatory setting. What does that process look like, and what would it entail for a ambulatory surgery center like Litchfield?
What we know is that more and more case types, different case types that are traditionally today done in the hospital will be moving out to the ambulatory surgery center, driven by government and payers' request. And so when we talk about services, when I was talking about services, it included all of the ambulatory services, urgent care, and surgery, as well as radiology services. And so, but today, being focused on, the ASC itself in Litchfield Hills, we would expand access to providers or cases that are currently not being done, but now need to be done in that setting.
This is Steve Lazarus. Just to follow up on something you mentioned earlier. You mentioned as part of your strategic plan. When you talk about the strategic plan, are you talking about the Hartford Healthcare's strategic plan for the service area, or are you talking about for the facility?
Is this a question to me?
Yes.
Yeah.
Yes.
It's really about, when I talked about the ambulatory footprint, it was Hartford Healthcare's overall strategic ambulatory strategy. And it's part of our network of care. And we're adding an ambulatory surgery center to that. Today, we're focused on adding the ambulatory surgery center piece to that network that they've built.
Okay, thank you.
Okay. Is Litchfield Hills Surgical Center at risk of closure due to financial or any other reasons at this time?
No.
Does the center currently charge any facility fees?
Yes, we charge a facility fee. The performance of surgery, the nurses that work there, the implants that we're an orthopedic surgery center, okay? So we perform surgeries that involve a lot of implants. The cost of those medical supplies, those implants, the nurses, all of those are involved in the facility fee.
And is the facility fee expected to be increased with the proposal? No.
I'm sorry, was that a no?
No.
Okay.
Yes, it was a no.
Okay, thank you. Little semantics and it never moved off Jessica, so I had to just hear this voice without a. All right.
Okay. Do the applicants anticipate initiating the imposition of facility fees under the new entity?
Ms. Rival, so just to clarify, currently ASCs charge a fee for the overhead component or like the technical component of the surgery, just like a hospital charges its fee. And then the physicians charge a separate fee. So that's not going to change. Is that
No,
what
I
you're
just
asking?
yes, I just wanted to assure the continuity that yes, there's a fee and yes, it's not going to change with the acquisition.
Correct.
Transfers of ownership of a standalone facility to a larger entity result in fewer standalone unaffiliated entities. Can you please describe how this will not have a negative impact on the diversity of ASC entities in the geographic region?
There are no other ambulatory surgery centers in our region.
So you are the only one?
We are the only one.
Where, do you know where the next closest one is?
Waterbury, maybe?
Okay.
Naugatuck.
All right. Page 28 of Exhibit S reads, in order to facilitate the shift of appropriate surgical cases to the ambulatory setting, the applicants plan to recruit 3 new orthopedic surgeons to join the medical staff once the application is approved, along with a podiatrist and 2 pain management physicians, which my understanding, the makeup of
Excuse me, Ms. Rival, can you please restate where you're looking?
page 28 of Exhibit S. And it starts in order to facilitate the shift of appropriate surgical cases to the ambulatory setting.
46. Just, I'm sorry, we're just trying to catch up with you.
Sure. Take your time, please.
What is it? Is that in?
240.
No, what tab is that in? 3. Okay, tab 3. Barbara, do you have it? If your question is just a question and you're not referring to a table, we're having some trouble catching up with you, but I think if it's not a specific table, we could try to answer.
Okay, I don't think you even need to really refer to the exhibit at this point.
Okay,
During testimony, you had stated that the makeup of the doctors that will be joining is different than what was originally presented in the original application. My question was, because of the makeup of the new doctors that will be acquired by the practice, won't this result in a change in referral patterns for the center?
I think there might be some confusion from a statement I made. At the time that the application was submitted, there was a plan to recruit new surgeons. Specific surgeons and their subspecialties had not yet been identified. Today, as we look forward, we have in fact identified these three subspecialties in the field of orthopedic surgery. So there's not really been a change, and it will, these are Charlotte Hungerford hospital affiliated surgeons who would be decanting from the hospital to the ASC. Is that responsive?
Yes,
Okay.
that answers my question.
So just to follow up on, just to kind of clarify, so how many physicians are currently practicing at the ASC? And does that include the 3 additional in that number now? And yeah, for now. And then if we can, and perhaps we may want to get is a, as a late file, list of all their specialties so we can sort of track that. But if we can talk about numbers first.
So there are 5 orthopedic surgeons that practice at the surgery center now. There are 3 additional orthopedic surgeons that practice at Charlotte Hungerford Hospital, which is about a 5-mile drive from our office and the ambulatory surgery center.
Are these, are they going to start performing procedures there, or would they be practicing there under full time?
So they each have their own medical practice. And so the way an orthopedic surgery practice works is we have a medical practice where we see patients from the community. And then if that patient needs to undergo some sort of surgery, wherever it would be appropriate for that patient to have the surgery, we bring the patient either to a hospital setting, an ambulatory surgery setting, or some procedures that are even done in the office if that's appropriate. These 3 other physicians, the foot and ankle, the spine surgeon, and the sports medicine surgeon, which are also, they're orthopedic surgeons with subspecialty focus, those 3 practice only in the hospital. And so by this, by Hartford being involved, they would now bring those cases from the hospital to the ambulatory surgery center.
And
You
since
have-
the,
Oh, sorry.
Oh,
Go ahead.
go ahead.
I just want to know if you, were these 3 doctors the only ones you're planning to bring into the surgery center, or would there be additional as well?
There might be additional surgeons. Right now, those 3 surgeons presently practice in Torrington.
Yes, there, based on need, there would be additional recruitment by the jointly owned ASC based on the demand and need and the type of surgeon and succession planning and all of those factors that go into recruitment decisions.
That was my only question. Steve, go ahead.
No, I was just going to suggest that perhaps, and this might be a little bit later on, we may want to get a revised projected utilization, because now that those might require updating with the 3 additional positions. So, but I think we'll do that separately. Thank you.
Okay.
All right, Ms. Rival.
All right. How will access be improved, for Medicaid patients in this service area as a result of the proposal?
Well, presently, we accept both Medicare and Medicaid patients, and that won't change.
Charity
Can I ask a follow-up on that? How would Hartford Healthcare, or how would HHC's charity care, or what is HHC's charity care policy currently?
I believe it's in the main application, the charity care financial assistance policy.
Okay,
As you may know, this is something that a tax exempt hospital is required to have. This policy that we've provided to you is quite comprehensive, and it focuses on eligibility criteria and the process for determining financial need based on the federal poverty guidelines. So it's quite expansive, and regularly it's going to be posted, and patients are going to be informed about this as soon as they have any kind of interaction or thought of going to the ASC.
and how does this policy differ from the current charity care policy in place at the Litchfield Hills Surgery Center?
We don't have a specific policy. It's on a case-by-case basis.
I think that just to distinguish between the two, like some private physician practices, most private physician practices do not have charity care policies, and we may, on an individual basis, work out a payment plan with patients, but it's not typically charity care as set forth in the financial assistance policy, which focuses on free care, reduced care, and things of that sort.
Okay. All right, thank you. Ms.
Throughout
Farr?
the, oh, I'm sorry.
Go ahead.
Throughout the application and the pre-file, it has been asserted that there would be no changes or little change to any existing services, relocation, termination, or addition at the proposed location. How will HHC's 2022 Community Health Needs Assessment and corresponding implementation strategy plan impact future health services in the PSA?
Yeah, so what we know about the community is that the population of 65 and older is gonna grow pretty high, one of the highest rates in Connecticut. So we wanna be prepared to be able to manage that influx of patient needs related to orthopedic services.
Just to clarify, in terms of the community health needs assessment, that is in fact performed by Charlotte Hungerford Hospital, where, as you know, they identify the needs of the community and implement approaches to addressing those needs. And to the extent that there is something identified that would be compatible with patients moving or shifting to the ASC, of course, that would be incorporated.
Thank you. Have you developed, or is there an existing transfer agreement with another healthcare provider? For example, Hartford Healthcare, Hartford Hospital, Charlotte Hungerford. And if so, can you provide us with a copy?
Presently, there is a transfer agreement as required by the state of Connecticut to Charlotte Hungerford Hospital.
And will that change at all with the?
That will not change.
I believe also, Ms. Rigel, that is part of the application, the transfer agreement, and that remains in place.
Great. Is there any plan to shift or transfer volumes or share equipment and staff between any HHC facilities in the PSA?
No.
Thank you. Can you please discuss how the proposal will enhance quality of care for patients?
Yes, we discussed a few of the details in standardizing care. So that means every patient going into the Litchfield Hills Ambulatory Surgery Center will get the same level of quality and safe care that they would have gotten at any acute care hospital within HHC. We are committed to make sure that all of our centers are going to go live with Epic, and that's that one medical record that will allow our providers to have critical information about patients at the site of care of where the patient is. We also mentioned Leapfrog. All of our centers will participate in Leapfrog, and I did mention that 2 of our centers were recognized this year and designated as top 12 in the country for quality and safety. So we will continue that journey with Litchfield Hills as it onboards with Hartford Healthcare if this is approved. We track specific quality data elements. We share best practices. We share our system has what we call institutes. And what that is it's people dedicated to a service, cardiology, cancer care, and every day they come in and really are focused only on that service and how they could provide and create policies, procedures, and protocols that are evidence-based. All of those are shared by the ASCs. We have infection control policies that are immediately adopted by the centers. They adopt all our policies, but we prioritize the charitable care policies, the financial assistance policy, which is the same thing, and all of our care and all the expertise that we provide is all evidence-based. So it's best practice. When we track and trend those data elements, they're all based on national standards. So what's the best in the country? And that's our goal. That's our low point of our goal. We want to be better, the best. We focus on this every day. Every day is part of my role as the Vice President for Partnership Integration. My job is to assure that our partnerships really develop and deliver sustainable clinical services to our patients that are the highest quality, equitable, and at the lowest cost possible.
Right. And can you just tell me approximately how long it takes to fully implement all these policies?
It really is, it takes time because what we do when we first get into the centers, we work together as a team. We prioritize, we do an assessment of the environment and compare to what our standards are at the acute care. And then we would map out a plan. My goal would be one day, but we do work on that and partner with our newest partners to plan and to make the most appropriate priorities first.
I have some follow-up questions. Does LHSC currently have a paperless medical system?
Yes.
Are you using Epic right now?
No.
Okay. What would this change? How would this change affect the Litchfield Hills surgery?
So Epic is much more comprehensive than the medical record that we're using. One of the key components of Epic is that the patient has their full medical record at hand. They don't have that with most other electronic medical records. And the medical record that we give patients is the medical record from our orthopedic practice. The medical record you get from Epic is the medical record from every practice that they go to and every physician that they see. And every lab value that they obtain. They could even get information from outside of Hartford Healthcare to other systems. If they've been out of state and they sought medical care out of state, they can get that health information on their same Epic medical record. That's on their smartphone.
How will Epic, the move to Epic in Litchfield Hills Surgical Center improve patient care?
Because we will have more of the information at hand from their other providers in order to see red flags for different types of surgeries or procedures or problems that they have.
Just in addition, when we have a standalone facility, it's really fragmented care, and the reason it is, it's not connected to any care prior to, we don't know what that patient had for services or clinical needs that they might have had. And then post-op, if there's any type of follow-up that that patient needs with an expert, we can then send a message to a specialist within the computer, and they will be connected once they leave with that expert and that expertise that they need. The care coordination is so important for safety and quality of our patients. Have you ever gone to the doctors or left the doctors, you lost your paperwork, you're not really sure, or you got some instructions for a future procedure and you don't know what you did with them? Epic can store that type of information, patient education, as well as appointment schedules. It's much more efficient and, like I said, safe, more safe for the patient.
You also mentioned Leapfrog and participation in that, but you didn't actually give us a good understanding of what Leapfrog is, if you could just tell us.
It's a consumer platform. It's designed for the consumer of healthcare. And what they do is they have quality metrics that are national metrics, and they follow them, and their database actually aggregates the data and then compares you to your peers. Leapfrog is voluntary, so, and what this is really about, if you want to hold yourself accountable through transparency of your quality and safety data, you submit your data. And all of our centers are on that journey. Our older centers, our legacy ones, once again, have submitted, and 2 out of their centers were named and recognized by Leapfrog as having high quality and safety measures in place. So the consumer will go online, and Leapfrog is for the acute care hospital, and it's really in a language that the consumer understands. Like for the acute care hospitals, it's A, B, C, or D. So if your hospital is a D, you know that that's not a high performing center. But for the ambulatory surgery centers, it's new since 2017, and they are still on a rating scale. They have not gone to the ABCD yet, but you can visually see it's a very clear and easy to understand for the consumer. And once again, we hold our centers accountable to participate. We want to be transparent. We want to understand where we can improve. And so that will be part of that integration into Hartford Healthcare that they'll be required to participate in.
Thank you very much. Ms. Rival?
That concludes my questions.
I think I have a few more questions, or actually, Steve, do you have any questions? I'm sorry.
Yes, actually, I do have just a couple of follow-up. So going back to the cost, traditionally when any service is provided by a freestanding facility, it tends to be lower cost than providing in a hospital. With Hartford Healthcare acquiring this facility, how would this impact how would this proposal impact the cost to the consumers in the primary service area?
Sure.
You know, it should not affect the cost. Yeah, I mean,
I just want to clarify that the applicants have not shared respective data regarding costs, so they're completely blind with respect to what each party's costs are. We do expect, if the application is approved, that the center will be doing higher acuity cases, which typically are reimbursed at a higher level. But we have no expectation that it will negatively impact the consumer. If anything, transferring or decanting more cases from Charlotte Hungerford Hospital to the Surgery Center will result, as Ms. Sassy testified, in significant reductions in the overall cost for these surgical procedures.
All right, okay. So for Hartford Healthcare, so based on your experience of acquiring other similar facilities, ambulatory surgery centers, what have you experienced, what have those facilities experienced in cost, pre and post acquisition? Have the costs traditionally, say, stayed the same? Have they increased, or have you seen the cost go down?
so, when we look at the traditional cases that are done in ambulatory surgery centers, it's not comparing apples to apples, because once again, we're getting a new migration of more acute cases. So if we were gonna remove a skin cyst, not as high acuity as a total joint. And just the nature of that case requires implants, which is a higher cost than my traditional case that has nothing to do with a total joint. So it's really about understanding like what that case in particular requires for surgery. And it really depends on each ASC that we have.
So based on your previous experiences, Hartford Healthcare has not tracked costs at any of the ambulatory surgical facilities to see if the costs have increased or lowered or stayed the same for the same acuity level procedures?
I think what, to try to answer your question more precisely, I think what Donna Sassy is stating is that when Hartford integrates with a freestanding ASC, they each come to the table with a different cost structure based on their historic negotiations with payers. We do know that that particular area in Torrington is a depressed area. And in terms of, if you look at some of the data that's in the application, you'll see that it is a somewhat depressed area with a large percentage of people that are in need, which makes Hartford Healthcare's integration here even more important. Do the costs, is there a difference in, do the costs go up? Well, first of all, we just heard significant testimony about the innovations and the enhancements that will be made, and those do have a cost. So there might be some increase in, I assume you're talking about what the reimbursement might be, and we can't globally address that, nor are we prepared to respond to that. But what we're talking about is making a more efficient, cost-effective surgery center that is handling more complex cases. For instance, at the ASC right now, they have a sprinkling of total joint cases performed there. we would expect the volume of those cases to go up significantly, which is going to be reimbursed at a much higher rate. So there will be, changes there in terms of revenue. But if you're asking us to generally say, we can't say that because we don't know their rates. We don't know whether the costs will go up. You're asking us whether, based on our prior experience, I can't answer that question. And I think it's a little bit of an unfair question in that we're talking about going from, no offense, Dr. Spiro, a Hyundai to a Porsche model of care. And so, yeah.
So,
One thing we do know,
okay, go ahead, sorry, go ahead.
one thing we do know is that the overhead in a hospital is much higher than in an ambulatory surgery center. So all of the programs that they have at the acute care center, transplants, cancer care, all of those cost money and is part of the overhead and the higher costs that we see in the acute care side. We don't have that overhead in the ambulatory surgery center, so in general, it's lower. Once again, at least 25 to 40%.
And has that been Hartford Healthcare's experience with its recent or past acquisitions of ambulatory surgery centers where the center's costs have dropped 25 or 40%, as you mentioned?
Compared to the hospital cost, yes. Yes, and in fact, I think there was literature that was provided as part of this submission with respect to CMS and Medicare, that the differential between a hospital-based surgical procedure and an ASC procedure is as much as 50%. So it's known that and proven and data supported that the costs are less, significantly less.
And if the witness can sort of help explain Hartford Healthcare's experience of its previous acquisitions of an ASC, if that particular ASC's costs have gone up or down?
Costs? Well,
Costs or procedures?
Can you please define what you mean by costs so that Donna Sassy can respond?
Well, if you can, if you look at a procedure that was performed at the center prior to the hospital's or not hospital, but the Hartford Healthcare's acquisition, would that procedure's cost stay the same, or has stayed the same, has increased or gone down?
Well, the fee schedules, as I think was previously testified, are not going to change.
So the procedure schedule, the fee schedules that are currently charged at Litchfield Hills, that would continue to remain the same moving forward.
Correct.
Okay. Currently, and moving forward, who would negotiate the contracts that get renewed for the ASC? Would that be Hartford Healthcare, or would that be the center itself?
There's no immediate plan, first of all, to change contracts. These contracts with the ASC are existing. So there's no plans, those contracts will run their course.
When they do expire, would they be negotiated by the center?
Yeah, so just so you know, for background, Hartford Healthcare, Donna, do you want to talk about integrated care partners? They have a clinically integrated network of providers where the providers share risk and are clinically integrated as that term is defined by the federal government. And that clinically integrated network, when those contracts expire, will be negotiating. And go ahead.
No, that's exactly it. ICP does, have that structure, and that they do provide care through their contracts with a risk piece to make sure that the outcomes and the quality are there. So they commit to that during contracting.
And, yeah,
If
and
you
Rhea.
refer to that, Doctor, I'm sorry.
No, I was just gonna say, if we can just have the
Okay,
witness,
yeah.
provide the testimony, it'd be easier, we can
Sure.
actually use it. Thank you.
Sure.
And just so you know, we, right now, Litchfield Hills has contracts in existence. When they come up for renegotiation, ICP will negotiate those contracts. And, ICP is what you call an accountable care organization, where they're going to be responsible for those outcomes of the patients, and they utilize that to be able to negotiate their contracts.
And when do the contracts come up for Litchfield Hills?
I have no knowledge of that.
Perhaps the doctor does,
I don't know, they come up yearly.
on an annual basis? All right, thank you very much. That's helpful to have. Attorney Novi, I would like to request a couple of updates through late files.
Of course, go ahead.
If we can get the financial attachment updated through the most recently completed year, and also include projections through, so we're just completing 2021, 22, 23. So probably through 24 or 25, whichever would apply. If we can have that as late file 1.
Mhm.
Can we also have as late file 2, the revised and updated pair mix table? And as a late file 3, any of the volume projections that were submitted in the application, if those could be revised to provide either through December of the most recently completed fiscal year as they were submitted, or the December 2022. And lastly, I know we have, no, I think that should be good for now. Thank you.
All right,
Actually, I'd like to request an additional late file
go ahead.
of the average facility fees assessed by Litchfield Hills Surgery Center for patients for each of the past 5 years, including the year to date. And also a definition of facility fees that the applicant are charging and are proposed to charge at the surgery center, and a narrative explanation as to how those differ from hospital facility fees.
And that will be late file 4. All right. Okay. Now I have a few follow-up questions that I would like to ask. Does HHC plan any capital improvements or renovations to the Litchfield Hills Surgical Center?
I think that'll be determined, depending on the need.
But do you have any planned upgrades scheduled at this moment?
Yeah, I mean, we would probably refresh and make sure it met the standards that we talked about, that, we have the technology that we need, that it is user-friendly for our patients, that it's, meets all the standards from a physical perspective, environment of care. So we'll once again do that assessment to update it and appropriately prioritize what we need to do.
Okay. Previously, financial aid was on a case-by-case basis. Can you explain why the Hartford healthcare policy is an improvement?
Because they have a choice to not take Medicaid and or other patients to that center. We're going to require them to bring the underinsured and uninsured to this center, which our charitable policy speaks to. So, and our journey to equity will continue in that service area.
And that's it for the questions that I have.
One other question, if I can just go
Yeah,
back and
go ahead.
follow up.
Sure.
This is Steve Lazarus. So I know you said the center does not have a charity care policy. Can you provide as the late file, I believe 6 it is?
We're on
5.
5.
Okay, late file 5. The number of, for the past 5 years, the number of, you had said it was on a per case basis that you provided financial assistance or charity care. Could you provide for each of the 5 years, or how many cases you did that for? How many individuals or cases received financial assistance or some sort of charity care
At the center,
at the center? And the last question that I have, it's more of a general question. If this proposal was not to move forward, what effect would that have on the center itself?
We would continue to do surgery as we do it now.
Can I add to that? That would impact Hartford Healthcare greatly. As we talked about a congested OR where there are cases that really don't belong in an acute care setting. You know, those patients in the literature, they talk about ambulatory surgery patients have a higher risk at an acute care hospital for infections, for poor outcomes. So we would impact our community's health tremendously in a negative way if we don't have that, as well as we would not be moving forward our mission to provide our patients with access to equitable, lower cost options for care.
Would the patients still not be able, why would the patients not be able to be referred to the center if as needed?
They can, but it's where the physicians are comfortable taking the patients. We don't drive where the surgeries are done. The physicians make choices.
So the physicians would refer the patients to?
The physicians probably wouldn't change their practice as they currently.
Presently, there are 3 physicians that do not practice at the ambulatory surgery center. Because this surgery center is an extension of my private practice.
Yep.
And so by bringing in Hartford Healthcare, it now becomes sort of like a hospital, non-determined facility where other providers would be more likely to bring cases. Right now, they don't bring any cases to my surgery center.
And I've had physicians tell me with our, some of our acquisitions in the ambulatory surgery world that they feel more comfortable now bringing the cases. Their voice has their voice can be heard for concerns or needs in an equitable way, you know, so we give them a platform, we listen to them, and we try to meet everyone's needs. We don't prioritize based on, you know, ownership or you know, location.
Right, but there's no legal reason that somebody can't be referred to the center for a
No,
procedure
but-
if it's not.
There is no
No.
legal reason.
That it's more of a physician preference or the referral pattern you're talking about.
Well, it's sort of like those physicians are not part of my practice because they don't choose to be part of my practice. This ambulatory surgery center is in the immediate vicinity of my practice.
Right.
And they won't bring, just as they are not part of my medical practice, they will not bring their patients to the ambulatory surgery center at my practice.
Right, and you don't allow anybody else, any other physician to practice, to
No,
perform
we do allow,
procedures?
we
You do.
do. We do.
You do? Okay.
Yes,
So if they wanted to, they could, they just choose not to. If
that's
they choose-
correct. That's correct.
And, you know, if we as a Hartford healthcare system can't control the quality, and we're not gonna, you know, suggest that patients go to that site. We also, you know, they today don't have to go live with Epic. They don't have to participate in Leapfrog. We want to elevate and validate the quality of care and maintain it, monitor it, and we'll be focused on that. Without us, once again, they're operating a well-run facility, but with the change in environment, with the acute care cases moving out there, they might not be as prepared as we will have them be prepared if we were not involved with the center.
And the idea is for the entire community. The entire community wants to use an ambulatory surgery center. It's a very nice setting to undergo orthopedic surgery. And so these other 3 physicians, even though they are able to use the facility, they will not use the facility because the hospital is their home, whereas the ambulatory surgery center is my home. They're welcome to come, but they won't come.
I understand. Thank you. One last question regarding the center. In the past 5 years, have there been any Medicaid patients that have been denied
No.
services? Okay. All right. Thank you, Attorney Novi. I think I'm all set.
One thing that I do want to add is part of, I know Medicaid is your question, but there's a lot of orthopedic surgery procedures that are not able to be done in an ambulatory surgery center just because of the government regulations of where they must be done. And so, and that environment hasn't changed very much.
Thank you.
Thank you. At this point, I will ask Attorney Feldman if she has any follow-up on the questions posed to the applicants.
Yeah, I just, thank you, hearing officer. I just want to follow up with Dr. Spiro with respect to his last statement regarding governmental payers and their coverage of ambulatory surgery cases in the orthopedic subspecialty. Have you reviewed the Medicaid fee schedule for ASCs in
Yes.
Connecticut?
Yes.
And based on your review, did you find that spine surgeries were covered by that fee schedule?
There are no spine surgeries that are covered by the Medicaid fee schedule in an ambulatory setting.
And did you find that there was sports therapy or sports medicine procedures covered?
There are procedures, but they're much limited than in the commercial and Medicare populations.
So just generally overall, looking at the fee schedule as you stated, did you see the Medicaid fee schedule for ASCs to be as comprehensive as the commercial plans are, or
No.
even Medicare?
No.
Thank you. No further questions.
All right. So at this point, I would like to go ahead and take a break. We will allow for public comment sign up to begin from 2 to 3 p.m. Afterwards, we'll have public comment at 3 p.m. and then we will close the hearing after public comment. So I would like, if it's possible, to take a break until 3 p.m.
Is hearing officer Novi, will I be able to make closing remarks at that point?
Yes, after public comment, closing remarks, and then we will end the day. You can speak after the public comment.
Thank you.
All right. All right, thank you very much. I would just like to actually, before we adjourn until we adjourn before public comment, I just want to remind everybody that we are transcribing today's hearing. So the transcription will also include the full hearing, including the opening, which was not captured on Zoom. So that will be available in the transcript that will be posted to the Con portal once it is completed. All right, it is now 11:17 a.m. and we will adjourn this hearing until 3 p.m. for public comment. Thank you, everybody.
Thank you.
Thank you.
Okay, as we were all just notified by the Zoom voice, it is 3 p.m. and we are recording this hearing. Good afternoon. This is the continued hearing for docket number 21-32445 CON. Hartford Healthcare Corporation, DBA HHC Surgery Center Holdings LLC and Litchfield Hills Surgery Center LLC. All right, I was informed by Mr. Posey that we did not have anybody who wants to make public comment. So at this point, we will go ahead, and if anybody does come on who wants to make a public comment, we will allow them some time, but we will move right into the late filing portion since we have nobody who wants to speak. Steve or Jessica, would one of you like to read a list of the documents that will be submitted as late files?
Yeah, let me start with the first three since I read them out. And then Jessica, you can just add the next ones. So I have late file 1, which will be the financial attachment that was provided as part of the application. We can get a revised copy of that. And that to include the most recently completed year, as well as financial projections through 2025. Next, late file 2 is the pair mix, an updated pair mix to include the most recent data. And late file 3 is any volumes or utilization that were provided in the application. If those tables can be updated and provided with the most recently completed, it's a fiscal year or calendar year, whatever format they were provided in. And if it was calendar year, it would be through December 2022. And then I'll turn it over to Ms. Rival for late file 4.
Late file 4 was to provide the average facility fee assessed by LHSC per patient for each of the past 5 years, including the year to date, and to define facility fees that the applicants are charging and are proposed to charge at the surgery center, and a narrative explaining how those differ from hospital facility fees.
Okay. And then there is a late file 5 as well. That Steve also asked for.
What was it? Which one was that
Sure.
one?
Late file 5 is the number of charity care cases
Yes.
for the past 5 years. Well, my notes are handwritten on the side of my paper.
Yes. Yes, it's the for each of the past 5 years, year.
All right.
That's it.
Attorney Feldman, when do you think you might be able to get those into us?
Sure, I'm happy to answer that. I just want to get clarification on late file 3, which is updated volume since the last filing. So that's through December 2022. You're not looking for new projections. This is just an update.
Yeah, this is just an update. Yes.
Okay.
If you have any revised projections you would like to, and you think have changed since anything you've submitted, then please do include those as well.
Okay, all right. So I think that obviously some of this will depend upon the work of others in terms of the preparation. So I'm thinking 2 weeks would be sufficient time to get you everything in one fell swoop, if that's workable.
Of course. Do you want to go to the end of business on January 27th, which will give you a little longer than 2 weeks?
Sure, that would be great.
Okay. So I am going to issue an order that all items listed by the OHS staff, that those be produced as late files by the applicants and the intervener, by the applicants, as the case may be, and that they be produced by the close of business on Friday, January 27th 2023. All right. And Miss Rival, can you memorialize that order in a letter?
Yes.
All right, thank you. All right, thank you, Ms. Feldman, for your help with picking the date for that. Or sorry, Attorney Feldman, thank you. All right, so at this point, Ms. Capozzi, do we have any public comments? All right, so we will now move on to the closing arguments and statement from the applicant's attorney. Attorney Feldman, would you like to go ahead and make your closing statement?
I would love to. This is a little bit slightly out of the ordinary. Right before we went to break, Mr. Lazarus asked us a question that I think we had some trouble understanding with respect to what was meant by cost. And we want to be as responsive as possible. So we're going to, if it would be okay with the hearing officer, I would, rather than have me answer that, I would request that Ms. Sassy be able to provide her best explanation to be most responsive to Mr. Lazarus's question. Is that okay?
Of course, yes. So before we move on to closing statements, I'll give you could go ahead and revive that line of questioning and have your witness go ahead and give some more testimony.
Thank you.
So I don't know whether Mr. Lazarus would like to restate the question for us, but based on our understanding of the question, we have a response. But if you would prefer to have him restate it, we're happy to try to respond.
No, you can just go ahead and respond. We'll just continue at that point.
Okay, sure.
Thank you.
Thank you for the opportunity to respond again. We had a discussion and we really want to communicate that we want to remind OHS that our prior two filings, we did submit the answers to your questions as far as whether the cost was impacted. So I just wanted to refer you to them. I know you did reference them in your question, and you do have that information available to you from our previous filings. In addition, I wanted to emphasize that the higher acuity case mix will come out of the hospitals and be moved if Litchfield Hills and Hartford Healthcare are approved to partner together. And as a result of that movement of cases out of the acute care side, the average rate is really likely to increase, but it's really due to the payer mix and the acuity, the case mix, I'm sorry, not the payer mix, but the case mix and the acuity of those cases. And as far as our contracts, as we move forward in Hartford Healthcare at the term of the current contracts that Litchfield Hills has, we'll negotiate those contracts through our ICP, which is our accountable care organization. You know, they are a clinically integrated network where all the providers share the risk and are incentivized to have the costs as low and the quality as high as possible. So I wanted you to have that information about ICP as they move forward, again, at the term of the contracts that are currently in place, but they're incentivized to make sure that whatever they contract is going to help improve the quality of care as well as lower the costs.
All right. Thank you.
Yeah.
Mr. Lazarus, any follow-up questions?
No, not at this time. Thank you.
Okay. All right. Attorney Feldman, any follow-up questions?
I don't have any follow-up questions, but I would like to just proceed to closing comments, remarks. Okay.
And now we can proceed to that. Go ahead.
Thank you. just to reiterate what we discussed this morning, or what the witnesses spoke to in their pre-file testimony of their oral testimony today, I think we heard that with Hartford Healthcare as a partner in this ASC, the care will be, the service will be, the technology will be, everything about it will be advanced and enhanced. There will be quality analytics, access to data that currently is not present. There will be benchmarking for performance. There will be feedback for performance improvement. There will be regular focus on patients and measuring patient satisfaction. There will be transparency and criteria by the patients for evaluating their experience, infection control, the whole process through participation in Leapfrog. We heard that we expect to see approximately a 40% shift of orthopedic cases from Charlotte Hungerford Hospital to a lower cost, equally safe surgical center with anywhere from 25% to 40%, and in the case of Medicare, 50% cost savings. Obviously, this all sounds wonderful, and many of our Hartford healthcare patients very much want to stay affiliated with Hartford Healthcare. I think some of the questions that we heard earlier is, why does Hartford Healthcare have to be part of this? Our patients we have a brand, and we've earned that brand because of the experience that patients have, what their expectations and their outcomes are. And patients receive a lot of comfort in knowing they're going to a Hartford Healthcare affiliated imprimatur healthcare center versus, let's say, another partner who doesn't bring all that expertise. We also know from the state healthcare facilities plan that OHS has focused over the years with the hospitals not increasing their inpatient bed capacity. This movement towards the development of a comprehensive ambulatory network, and we're not just talking about surgery centers, we're talking about the whole array of ambulatory services, is essential. And that became very obvious to us all during COVID, when the hospitals were at or above capacity, and we were using other facilities, mobile tents, setting up all sorts of alternative sites for decanting inpatient volume. This is really what we need to be doing to be prepared for the next pandemic. So we believe that OHS supports this notion, this concept that is nationally being rolled out for hospitals to develop ambulatory networks, simply because patients want that. Hospitals, of course, need to continue to have revenue, and there is great value in having, continuity of care and communication between the hospital, the ambulatory networks, and all the physicians who care for the patient. This is entirely patient focused, and it's all about the patient experience. And I don't know whether some of the folks at OHS have, had surgery on an inpatient basis and also had surgery on an ambulatory basis. It's a very different experience, and it's, for one, certainly equal in terms of quality, lower in terms of cost, less intimidating for the patient, and easily accessible for a patient. So I think that the time has come whether it's the payers that are demanding that their patients who are insured by them receive care in lower cost alternative centers. But it's very important for Hartford Healthcare to have a solid and comprehensive ambulatory network where there's going to be a significant savings for the entire state healthcare system, not only the payers. But just from a practical standpoint, this will decompress the hospitals so that elective cases, and this is the reality that we have learned from our surgeons, don't have to perform elective cases at 9 p.m. in the evening at the end of the day, simply because they're just too busy in the hospital to take those elective cases earlier in the day. We know for a fact that this particular ASC is not operating at full capacity. It's operating at about 30% capacity. We believe that it can be more efficiently run with the recruitment of additional surgeons who are more willing to do surgery at the ASC with Hartford Healthcare as a partner versus going to the ASC of a competitor. And I'm being very transparent and frank with you about sort of what are the roadblocks sometimes in getting surgeons to shift their care. So we fully expect that this ASC will reach a greater capacity and level of efficiency with the recruitment of more surgeons and the continued shifting of cases by the payers to ASC centers. The goal, as stated in the application, is to enhance the ASC and widen the scope, the population that is currently served. And most importantly, with HHC as a partner, we will be able to open the doors to more patients because there will be inclusion of the financial assistance policy or the charity care policy. So the decanting of surgical volumes from the hospital to ambulatory settings should be fully consistent with the state's healthcare plan, including its commitment to serving the underinsured and uninsured patient population in this area. So in closing, I want to thank you for your questions. I want to thank you for the opportunity that we had to explain our reasoning and rationale behind this application, and I'm hopeful that the testimony that you heard today was as responsive as necessary, and we're very eager to hopefully get approval so that we could, given that this application has been pending for some time, get going. So thank you.
All right. Thank you, Attorney Feldman, and thank you to your witnesses that you brought today. I just want to again remind everybody that the transcript will include the full hearing, including the opening, which was not captured on Zoom. The late file exhibits will be due by the end of the day on January 27, 2023 by 4:30 p.m. Thank you, everybody who attended today. It is now 3:19 p.m. and we will be adjourning. This hearing will be adjourned and the record will stay open until closed by OHS. Good afternoon. Have a good afternoon, everybody. And thank you.
Thank you.
Thank you.
Thank you very much.
Thank you, everyone.